can see my screen okay?
Indeed we can.
Excellent. I'll hide my own face here. All right, really excited to be with you today. For some of you, this image will look familiar, others it's brand new, but really excited to introduce you to Heidi, or reintroduce you. We first met Heidi back in August of 2020. We walked through her COVID-19 testing journey and all of the data that was created in that process. We've used this fictional patient story as a model for understanding the importance of finding different ways to connect systems and data in order to study real-world performance of EUA diagnostics. And what we've observed since the first COVID vaccine EUA in December is a similar set of real-world data challenges and opportunities in the vaccine space. So today we're picking up where Heidi's testing story left off as she becomes eligible for the vaccine. We're going to trace Heidi's story from left to right around the arc, and we're going to start over here in February. So Heidi gets a call from a friend who tells her about a chain pharmacy that's an hour away that has last-minute appointments available. So Heidi hops in her car, she drives an hour to get her first dose of an mRNA vaccine that afternoon. This story might sound familiar to some of you. Then in March, when it's time for her second dose, Heidi realized that there was a mass vaccination site that had opened up just 5 minutes away at a nearby stadium that was administering the same brand of mRNA vaccine as the pharmacy. And she decided to get her vaccine there instead because it was a lot closer, more convenient for her. Then earlier this month, earlier in April, Heidi wakes up with a pounding headache, fever, and body aches. And so she goes to her primary care physician the next day, where she tests negative for COVID, but positive for influenza. And if you know Heidi, you know that Heidi has some really bad luck. So imagine also that a year from now, next April 2022, Heidi suddenly loses her sense of taste and smell, but she otherwise feels fine. So she schedules a COVID test at her doctor's office just to make sure. And surprisingly, she tests positive for COVID. So, of course, this story isn't really about Heidi. It's about Heidi's data, as it always is. And each step along her vaccine journey, Heidi's interactions generate a variety of data points. And there's some listed here. It's an abbreviated list just for illustration, so you can get a sense for the types of things. But you could imagine the data that might be collected at the point of vaccine or the point of care as she sees these different providers. And throughout this story, we'll use the color green to represent data generated at Heidi's primary care physician's office, and pink to represent data generated from a vaccination site. So let's see what this looks like on the map. Now, as you look at this chart, we've added some labels here. So on the inner ring, you're going to see the representation of data points that are provided to the and flowing to Heidi's insurer. In the, and you'll notice down here, we added some green dots to the past patient history that represent historical data generated by previous primary care visits that show up in Heidi's insurance claim information. This pink section here is where we'll plot data that exists in a vaccine administrator's system. Think the pharmacy system or the system at the stadium. In the green section is where we'll plot data that exists in the physician's electronic health record, and the outer white section is where we'll show the state immunization information system. Now, the pharmacy where Heidi got her first vaccine dose did submit a claim to her insurance. And so you'll see that the data about this vaccine lives in 3 places: in the vaccine site, the pharmacy system, in her insurance, as well as the state information system. The stadium, however, did not bother to collect Heidi's insurance information. So that information is only in the vaccine site database as well as the IIS. And Information about Heidi's symptoms and test results post-vaccine exist in her primary care physician's electronic health record and likely in her insurance data as well as it passes through in the claims process. And the same goes next year when Heidi goes back to her primary care physician for testing. We'll see the same information living between the provider and the insurer when Heidi presumably tests positive for a new strain of COVID. If we just look at data from Heidi's primary care physician, we wouldn't know that Heidi was vaccinated. If we only look at the state immunization data, we wouldn't really know what happened to Heidi before or after that vaccine. And if we only look at insurance data, we get a fairly complete picture, but with one major problem. We would have no idea if or when Heidi got her second dose. Now, if you've been listening carefully to our other presenters today, you've probably realized that there are other ways to get this data, and there are a number of ways to piece the story together. We know that it's possible in some cases to leverage health information exchanges, for example, either at the state level, potentially commercial data aggregators, or even commercial exchanges such as Care Everywhere. And these can help piece together a patient's story. And they can also push data directly into insurers, which we've heard about earlier. So there are a couple different ways this can be done. But it leaves some open questions. What if Heidi crossed state lines to get one or both of her vaccines? Or what if she changed insurers midway through the process? Or what about these specialty COVID vaccine registries that are separate from the standard vaccine information systems? How might we get these various IIS systems to talk to one another and create a fuller picture across the country? Because we have to remember that Heidi is just one patient. And there are 330 million Heidis in this country, each with their own unique story. And so this is not an easy problem to solve, and there isn't a magical repository of vaccine data. It does exist in a lot of different places, in a lot of different permutations, but we don't need perfect. Because the challenge is to make sure that we understand the data sets and their strengths and limitations, which will help us determine what types of research questions a data set can and cannot answer, which populations to include or exclude, et cetera. And as our fearless leader, Dr. Amy Abernethy likes to remind us, hard things are hard. And we are really excited that the Reagan-Udall Foundation and Friends of Cancer Research are boldly venturing into the world of COVID vaccines. And if you have data like our friends who presented today that you think might be interesting or help answer some critical questions about vaccine safety and performance, please do reach out and let them know. And now I'll turn it back over to Susan to take us home.